Hello, and welcome to How to Save 47% on Healthcare Premiums. In the next 15 minutes, I'm going to show you that there's an affordable alternative to Obamacare, officially known as the Affordable Care Act. I'm going to show you how to save an average of 47% off your healthcare premiums. I'm going to show you how to have healthcare the way healthcare was meant to be. I'm also going to show you how to take control of your healthcare by removing the government from your healthcare. I'm going to show you how to totally eliminate deductibles in many situations. If you have been without insurance because it was too expensive, I'm also going to show you that comprehensive healthcare is actually affordable. And lastly, I'm going to show you how you can save money on costly prescriptions. If all that sounds good to you, let's jump right into it. Okay, so there is an affordable alternative to Obamacare. Healthcare premiums are at an all-time high, but they don't need to be. If you are healthy, you're between the ages of 18 and 64, you do not qualify for subsidies, you are not in Medicare, Medicaid, or Medi-Cal, and you have no pre-existing conditions, you are paying too much for healthcare, plain and simple. Obamacare does have its place and benefits for many people. However, it mainly serves those with lower incomes and those with pre-existing conditions. Those of us that are healthy and that make too much money to qualify for subsidies end up footing the bill for those lower income earners in the form of higher premiums. And those of us that are healthy also end up paying for services that we don't need, such as drug and alcohol rehab, mental health services, and more. Also, under Obamacare, you are limited in the scope of your coverage in the form of smaller regional networks, where you have a primary care physician that serves as a gatekeeper. This gatekeeper dictates and controls the referrals we need in order to see a specialist. Then, oftentimes we find out that specialist is out of network, which results in unexpected out-of-pocket medical costs. So in a recent Kaiser Family Foundation tracking poll, 4 in 10 adults, roughly 39%, report that they had a surprise medical bill from a doctor, a hospital, or a lab in the last year. How crazy is that? Additionally, 10% of those people report that an unexpected medical bill was from an out-of-network provider. So a further analysis of large employer health plans showed that almost 18% of inpatient admissions result in non-network claims. So for the roughly 40% of people that are covered under Obamacare, these surprise medical bills have the elements of a perfect storm that could result in financial disaster. So what is the answer? Well, what if I could provide you with a solution to healthcare the way healthcare was meant to be? What if I could provide you with an affordable healthcare plan where most of our clients that are without subsidies save at least 47% off their healthcare premiums? What if I could provide you with a healthcare plan where you have access to a nationwide network of the best hospitals and the best physicians in the country, where everyone was in network? What if I could show you how to save money on your prescriptions or how to eliminate deductibles in many situations? What if I could show you how to eliminate almost any chance of a surprise medical bill? What if I could provide you with a healthcare plan where your low monthly premiums provide you with free telemedicine, where you have access to a board-certified U.S. physician 24 hours a day, 7 days a week, who can diagnose 80% of the common ailments, such as the flu, a sore throat, the common cold, and more. All of that over the phone and without you ever having to schedule an appointment or go to a clinic. They simply diagnose your ailment over the phone and they call the prescription into your pharmacy. How powerful is that? Imagine the time savings. Imagine not having to leave home when you're feeling your worst. So how is this sounding so far? Pretty good? All right, well, it gets better. What if I could show you a plan that included free preventative care for things such as immunizations and injections, colorectal cancer screening, breast cancer screening, diabetes screening, blood pressure screening, and over 50 additional screenings? What if I could show you a healthcare plan where your low monthly premiums provided you with free labs and diagnostics, free x-rays, $20 primary care office visits, $20 urgent care visits, the freedom to choose an individual primary care physician for everybody within the same family, the ability to have an OBGYN as a primary care physician, and $500 emergency room visits. All of this before you ever have to pay a deductible. Would that be of interest to you? If your answer is yes, I do have that solution, and it is more affordable than you could have ever imagined. My name is Michael Nash. I am the co-founder and CEO of Clear Diamond Life. My company specializes in finding solutions for our clients in healthcare, college planning and college funding, life insurance, and sophisticated financial strategies through life insurance and annuities. We spend countless hours researching and analyzing the best products in these areas for our clients. With that being said, I want to introduce you to our top choice for healthcare for this year. It is a revolutionary form of healthcare. This form of healthcare has been around for decades, yet many people are completely unaware of it as it has been available only to a select few organizations. This healthcare plan provides us with an affordable alternative to Obamacare. It is called Modern Health Sharing. Modern health sharing plans put you and your family at the center of great healthcare in the form of health sharing ministries. These health sharing ministries are open to everyone, regardless of religious affiliations, race, national origin, sex, sexual orientation, and other protected statuses. This is the best private healthcare plan in the largest PPO network in the nation. This PPO network was recently featured in U.S. News and World Report magazine of having access to 19 out of 20 of the nation's top hospitals and 20 out of 20 of the top hospitals in California. The company we have selected for our top choice in healthcare for 2019 is Trinity Alira Healthcare. Trinity Alira Healthcare Sharing Ministries provide us with access to over 1 million doctors and hospitals throughout the country that are in network. Trinity Alira is a nonprofit private health sharing plan. It is healthcare the way healthcare is meant to be. By removing the need and greed to make a profit, savings are passed directly to you in the form of lower monthly premiums and, in many cases, up to 47% savings off your current premiums you are paying. So, how do they do this, you may be asking? Well, similar to how Costco keeps costs low for its members, Trinity Alira's group medical needs are shared among its members, and you are not paying for services that most healthy people do not need nor do they require. It is important to note that Trinity Alira Healthcare is not health insurance as we traditionally understand it to be. It is a private, members-only healthcare plan that operates almost exactly the same as insurance, but in many ways better. You get an ID card like you normally would with any health plan. Providers are paid directly by Trinity Alira. There are no claim forms to complete. And another important item to note is that Trinity Alira Healthcare makes no promises to pay claims that are not medically necessary or that are elective or cosmetic in nature. All benefits are covered immediately. However, annual physicals do have a 9-month waiting period. There's a 12-month waiting period for cancer coverage, and most pre-existing conditions have a 24-month waiting period. Other than those obvious clauses, there is guaranteed acceptance for everyone, provided that the member adheres to a very liberal statement of beliefs. This statement of beliefs promotes a healthy and morally sound lifestyle, and I've never had anyone that could not agree with the following statement of beliefs. The belief in a God where every individual has the fundamental religious right to worship God in their own way. Where we believe is it our moral and ethical obligation to assist our fellow man when they are in need according to our available resources and opportunity. We also believe is it our spiritual duty to God and our ethical duty to others to maintain a healthy lifestyle and to avoid foods, behaviors, or other habits that could produce sickness or disease to ourselves or others. And lastly, we believe it is our fundamental right of conscience to direct our own health care and consultation with physicians, family, or other valued advisors. That's it. If you can agree to that easy-to-live-by creed, you are guaranteed to be accepted into the Trinity Alira Healthcare Ministry. It is also important to note that this alternative to Obamacare is not ACA tax exempt. However, beginning January 1st of 2019, the tax penalty for not having coverage through ACA has been completely eliminated. So again, if you're between the ages of 18 and 64, you do not qualify for subsidies, you are not in Medi-Cal, Medicare, or Medicaid, you are reasonably healthy, you have no pre-existing conditions, there is not a reason in the world why you should not have this health care plan. Okay? So you're probably asking yourself, will this save me money? Well, of course it will. So let's look at a few examples. Chris is a single 34-year-old realtor and he makes over $100,000 per year. Chris is in good health. He has no pre-existing conditions. He does not qualify for ACA or Obamacare subsidies, and he's a non-smoker. Chris would like a fully comprehensive health care plan and does not want any surprise medical bills. And also, he does not want to pay more than $325 a month. But before we look at Chris's options, remember earlier when I said that there was a way we could eliminate deductibles in most situations? First of all, it's important to note that most people are accustomed to the word deductible. In the Trinity Alira Health Sharing Ministries, we refer to that term as MSRA rather than the term deductible. MSRA stands for Member Shared Responsibility Amount. It means exactly the same as deductible, but because this technically isn't insurance, but rather a healthcare plan, we must use the term MSRA. Does that make sense? Cool. All right, so in Chris's situation, similar to his Obamacare plan, he would have a $5,000 deductible, which we now call MSRA, for hospitalization, inpatient surgery, or outpatient surgery. However, before Chris ever has to pay any MSRA whatsoever, his low monthly premiums include free 24-hour telemedicine, free labs and diagnostics, free x-rays, free wellness and preventative care, $20 doctor office visits, $20 urgent care visits, and $500 emergency room care. All of this for a low monthly premium of $315.92. So circling back, Chris is a single 34-year-old realtor, makes over $100,000 per year. He's in great health with no pre-existing conditions. He does not qualify for ACA or Obamacare subsidies, and he's a non-smoker. Chris's monthly premium would be $315.92 a month with an MSRA of $5,000. However, Chris has another option. So check this out. Chris can opt for a higher MSRA and a lower monthly premium. This gives Chris the option of having a supplemental health care plan in addition to his comprehensive health care plan that would totally cover his MSRA in the event of a heart attack, cancer diagnosis, a stroke, a critical illness, or an accident, all while staying within budget, and it greatly reduces the chance of any surprise medical bills. So let's look at what happens when Chris opts for a lower premium and a higher MSRA. Chris now has a monthly premium of $236.72 and an MSRA of $10,000. What Chris has also done is he has added a supplemental health care plan that will cover his MSRA for hospitalization in the event of an accident, a heart attack, a stroke, a critical illness, a cancer diagnosis, all of that for $30 additionally per month. Now, this is what's really cool. Chris may use that $10,000 any way he wants to, as it's a lump sum benefit paid directly to him. So let's review Chris's options. Chris can pay $315.92 a month and have an MSRA of $5,000. Or, as we see in option 2, he can have a lower premium of $236.72 a month with an MSRA of $10,000. However, in option 2, he protects himself against major catastrophic occurrences that could arise for an additional $30 a month. That gives him the $10,000 benefit that can offset his MSRA. The total monthly premium he will pay for both policies is $266.72 a month, which is about $50 a month lower than option 1 and more than $60 under his budget. So you can see that by lowering his monthly premium and increasing his MSRA, Chris now has better comprehensive coverage and has reduced the chances of out-of-pocket expenses and surprise medical bills as a result of adding the supplemental protections. So now that you understand how the MSRA works in conjunction with supplemental health care plans, let's look at a couple more quick examples. LeBron and Chantel are married. They are 47 and 41 respectively. Their annual income is $212,000 annually. They are both in great health, and they're both non-tobacco users. They do not qualify for Obamacare subsidies. They have chosen the same value plan that Chris selected in our first example. Now, their budget is $750 a month. So like Chris, they're also going to have the same two options. The first option is a lower MSRA with a higher premium of $513.81 a month, or they can opt for a lower monthly premium of $444 a month and increase their MSRA to $10,000. But they can protect themselves against the catastrophic events we just covered in the supplemental plan for an additional $92.10 a month. That gives us a total of $536.61 a month, which is well below their targeted budget of $750. Now, let's quickly look at Enrique and Maria. They are married with 4 children. They're currently paying $1,388 a month through their Obamacare program. Again, they are paying $1,388 a month through their Obamacare program. They have no subsidies. They are a non-tobacco family. Everyone's in great health. They too have selected the value plan. So Enrique and Maria, with 4 children, in option number 1, they could pay $711.81 a month with a $5,000 MSRA, or $583.11 a month with a $10,000 MSRA, and an additional $99 a month for a $10,000 supplemental health care plan benefit for a total of $682.61 a month. That, my friends, is a savings of over 50% a month with better coverage and a better network with a better selection of hospitals and doctors. Sounds pretty good so far, doesn't it? Well, I hope you can see how these numbers can relate to your situation. In our last example, let's look at Kathy. Kathy is single, she's 24 years old, and she's a personal trainer. Kathy does not have health care because she thinks it's too expensive. However, Kathy's parents worry about her because she rides a motorcycle to work every day in Southern California, and we all know what that traffic is like. Now, she wishes she could just have a basic plan that would cover her in the event of an accident. So for Kathy, who wants minimal coverage, she is going to select a catastrophic cost-sharing plan that covers emergency room, inpatient services, inpatient x-rays, CT scans, MRIs, hospitalization, and inpatient pharmacy. All of this for $125 a month with a $5,000 MSRA. Or she could have a lower premium of $104 a month with a $10,000 MSRA, adding a supplemental health care plan just like everybody else in our previous examples for an additional $36 a month, or a total of $140 a month for complete coverage. With plans this affordable, how can you possibly go without coverage? Again, in the value plans in our first 3 examples, your low monthly premium includes free 24-hour telemedicine, free labs and diagnostics, free x-rays, free wellness and preventative care, $20 doctor office visits, $20 urgent care visits, and $500 emergency room treatment, all of that before ever paying an MSRA. You get all of this in the nation's largest PPO network where you have no gatekeeper. You control your own health care without government involvement. You make the choices that are best for you. Obviously, this is something that does interest you, otherwise you would not have stuck around this long. So here's what you're going to do next. Schedule a free, no obligation phone call with me right now. Here's the link to my calendar below. When you click that link, you have 2 choices of appointments to choose from. There's a 15-minute appointment. If you have a few remaining basic questions, I'd be happy to answer those for you. Or there's a 45-minute appointment if you're ready to take control of your healthcare by enrolling immediately. But before I forget, I also promised you that I would show you how to save money on your prescriptions. If you have the basic Covered California Bronze plan, your monthly deductible for prescriptions is $500 monthly. How does that even help anybody? It's absolute insanity. The Trinity Alera healthcare plan has a built-in prescription discount program that reduces the cost of prescriptions. However, I found a couple of websites where you can save even more money regardless of what healthcare plan you choose. And I've just included those links below. Now, I've personally used the Canadian pharmacies as they ship directly to your home or office. However, if you do use a Canadian pharmacy, be sure to only select the medications that have either the Canadian or the British flag flying next to them, because those are the medications that meet the same rigid standards of the FDA. Or even better, you can go to the link below and get your free prescription drug discount card, where you simply take it to your favorite pharmacy, you present it along with your prescription. You will then automatically receive the lowest price that is available for that prescription at your pharmacy. You really should have this card regardless of what health plan you are on, and it's free. So there you have it. I have showed you how to save an average of 47% off your healthcare premiums. I have showed you how to take control of your own healthcare by removing the government from controlling your medical decisions. I have showed you how you can eliminate deductibles or the MSRA in catastrophic events. And finally, I have showed you how to save money in costly prescriptions. So what are you waiting for? Click on the link below, schedule a call with me right now. I will call you at the exact time you select, I promise. If you would rather call me directly, you may do so by calling 858-225-6888. However, I will warn you, this is open enrollment season, and I'm extremely busy helping other people like you save thousands on their healthcare premiums. So you're much better off scheduling an appointment with me by clicking the link below. Lastly, you more than likely know someone that could benefit from this healthcare plan. Someone that is paying too much for their healthcare. Someone that thinks healthcare is too expensive. Chances are extremely high that, like you, they have no idea healthcare plans like this even exist. So please, I implore you, give them my information. I am passionate about helping people with this amazing alternative to Obamacare. I promise you won't be disappointed. Thank you for your time, and I do look forward to your call.